Hello everyone, Assalamualaikum warahmatullahi wabarakatuh. I hope everyone in here is in a good health so we can learn and discuss together in this course. My name is Yudi Fitranti. You can call me Mrs. Deni, and I'm a lecturer in Department of Nutrition Science, Faculty of Medicine, Diponegoro University, Indonesia. Welcome to this online summer course organized by Diponegoro University, which the topic is Child Nutritional Aspect, the first 1000 days of life in coastal region. And now I will tell you about nutritional assessment, especially about the anthropometry method and its implementation in community setting, and more specific in stunting case study. And first, I will tell you about the learning objective in this class. The students are able to explain definition of nutritional assessment and anthropometric method. And the second, the student able to explain the type of anthropometric method and how to measure it to assess nutritional status, especially stunting, and to assess nutritional status using growth chart. And the last one is to explain development and implementation anthropometric method in community setting. So, based on that learning objective, the outline that we can discuss are definition of nutritional assessment, definition of anthropometric method in stunting case study, growth chart, and development and implementation anthropometric method in community setting in Indonesia. Okay, now, what is the definition of nutritional assessment? Nutritional assessment can be defined as the interpretation of information from anthropometric, like height, weight, BMI, mid-upper arm circumference, and biochemical or laboratory analysis of blood, urine, and other body tissue. Clinical and physical examination by observing in sign and symptom. Dietary including quality and quantity of the food consumed and eating habit. All these data are collected to determine whether a person or a group of people are well nourished or malnourished. Malnourished also have a two side, overnourished and undernourished. Therefore, nutritional assessment is also known as ABCD method. But some references also mention that nutritional assessment include A, B, C, D, and E. Anthropometry, biochemical, in clinical and physical examination, dietary, and the last one is ecology. Ecological factors include the environmental around the person that is able to play role in a person's nutritional condition. For example, many studies show that feeding practice is the one of the predictor of nutritional status of children. So, next we will discuss more deeply about the anthropometry, especially in stunting case study. Let's go to the definition of anthropometric method or anthropometric assessment. Anthropometric come from word anthropos. Anthropos, which mean man or human. and metric, which mean measurement. So according to the Jalif 1966, anthropometry is a measurement of the variation physical dimension and gross composition of the human body at the different age level and degree of nutrition. Anthropometric measurement include height, length, weight, head circumference, mid upper arm circumference, and all these measures are body dimension and have a unit of kilogram, centimeter, or meter. The advantages of anthropometric method are: first, simple and safe, non-invasive technique, and also applicable to large sample size. And the second is inexpensive equipment, and it is portable too. Number three, relatively unskilled personnel can perform the measurement procedure. Of course, so someone who is not a nutritionist can use it, like a weight scale that everyone can own and use. Precise and accurate, and then retrospective information, and mild to moderate undernutrition can be identified. The scholar trend can be evaluated by seeing the change of nutritional status each month. And the last one is screening tests that identify individuals at high risk to under or over nutrition. And the limitation of anthropometric method are insensitive. It cannot detect disturbance in nutritional status over short period of time, and it cannot identify any specific nutrition deficiency. So, the limitation of anthropometric method is insensitive. The following are steps in performing anthropometric measurement on a person. First, of course, we have to measure the respondent. After the respondent, we have to convert the data into the index. For example, height for X index, BMI for X index, yeah. And then we have to compare with the relevant reference, and then the last interpretation of information. Okay, before discussing anthropometry in the stunting case study, of course we must understand what stunting is. The stunting is impaired growth and development that children experience from poor nutrition, repeated infection, and inadequate psychology simulation. Anthropometry method used in assess the stunting is height. For infant and children under 2 years old, use a length board. This picture shows three measuring instruments. They are commonly used in Indonesia. The picture number one, this is the brain seka, length board brain seka, and made by plastic but hard material, and this one from plastic but softer and can be folded and rolled. and this one are made from wood. Before use, make sure that these instruments are placed in the flat surface. Usually we use a table or in floor. Next, this picture shows the overall weight of measuring body length. Need to end numerator. One person holds the heel and read the result, and the other holds the head of the children. And the position head of the children is make angle 90°. Okay, we go to the stage of measuring body length. First, instrument preparation. Length board have a board on both sides. Make sure that the length board placed in the flat surface so board can be moved easily. One side is a fixed board where the head is placed. Because it's made of hard material, it is better if the side where the baby head is placed is covered with a thin cloth to make the baby comfortable. Second, respondent preparation. Make sure the head and foot accessories is removed because it will affect the result of the assessment. The next picture, the baby is placed on the length board with the head on the fixed board and the feet in the move board. Mother can help the measurement process by calming the baby if the baby strangled. When the baby can be controlled, position the two facing up and the baby heel are attached to the length board. Knees are gently pressed so the both legs are straight. Position the head strange view up so form a vertical Frankfurt line. And after head and heel in the correct position, note the result that appear on the scale body length. Body length measurement in the younger baby are generally the same, but the knee do not need to be pressed. Just stick baby heel and feet onto the board. As well as overweight kid, position and heel and head must be correct. The children over 2 years old, the term used in is height, not body length. The instrument or tool that are commonly used are microtoa and stadiometer. The microtoa be properly installed on the flat wall and perpendicular in the flat floor. In this part, this is hang for 200 centimeter above the floor, and in this part, when pulled down to touch the floor, the scale will show 0. It means that microtoa is ready to use. Stadiometer must be placed in the flat floor. Okay, and then how to measure height with microtoa? First picture tell us about the preparation respondent before measurement. Of course, before that, microtoa was installed properly. We can see what is done in the first picture. Untying hair and removing footwear such as shoes or sandal. After that, ask the child to stand straight under the microtoa with the body flat against the walls. Calf and knee gently press to ensure a straight leg position. We can see this picture. These are there are some limb that must be attached to the wall: head, shoulder, bottom, calf, and heels must be attached to the wall. The child head is straight ahead to form a Frankfurt horizontal line. And then microtoa is placed on the top of child head, and the enumerator record the height number on microtoa scale. The enumerator eyes, when viewing the scale, are parallel, can be above or can be below the scale. Measurement of height in overweight children sometimes does not allow the back of the body against the wall entirely, so that only the part are allowed against the wall, for example head, bottom, and heel. This picture shows that measurement of height need two enumerators. One person holds the respondent or child head properly and read the result on microtoa scale, and the other is make sure the heel against the wall and also press knee against the wall too. Is in this picture also show that 5 parts that must be attached on the wall: head, shoulder, bottom, calf, and heels. Okay, now what are the errors that often occur when taking measurement? First is incorrect method for age. Someone is often wrong in calculating age. This is very important because instrument used depend on age, as we know, like birth for child under 2 years old and microtoa for child over 2 years old. Second is footwear or headwear not removed. We often see this because the baby is crying, fussy, and make the enumerator forget to take it off. Head not in correct plane, and the bird not firmly against heel or head. To reduce error, the enumerator must have the skill to calculate age correctly. Child age is calculated in month because the relevant reference for assessing nutritional status requires X data in month. For example, if the child is 2 years old, we write in as 24 months. How to calculate it? By subtracting the date of measurement with the date of birth. For example, birth date August 30, 2019. Measurement date August 26, 2021. So then we subtract. The result is 1 year's 11 months or 23 months. Here we find that the child is only less than 4 days to get to 24 months, but still decide to be 23 months because it has not been a full month. After measuring length or height, the next step is converting measurement to index. An index is a combination of two measurements or one measurement plus the person's age. Stunting To assess the stunting using height for age for children under 2 years old and height for age for children over 2 years old. A reference used to assess stunting status by plotting height, leg, and age data into growth chart. There are many growth charts developed, either developed by a world organization like WHO or developed by country. CDC charts are growth standards that describe how healthy children should grow under optimal environmental and health conditions, while WHO charts describe growth and of healthy children in optimal conditions. United States has been using CDC growth chart as a national reference to measure the growth of children and teens aged 2 until 19 years. European countries such as Netherlands, United Kingdom, Germany, and France will also had their own country-specific growth chart, and Indonesia used the WHO standard growth chart 2005. There are many differences between CDC and WHO growth chart, especially in sample selection. This one is CDC, this one is WHO. The CDC have one criteria, exclusion criteria. There is a very low birth weight, while WHO has several in exclusion criteria such as a low eco-socioeconomic status, birth at altitude more than 1,500 meter, birth at less than 37 weeks or over than 42 weeks, multiple births, perinatal morbidity, child health condition, maternal smoking during pregnancy and or lactation, breastfeeding for under 12 months, introduction of complementary food before age 4 months and after age 6 months, weight for length measurement over 3 standard deviation above or below study mean for sex. About the breastfeeding journey, approximately 50% ever breastfed in CDC sample, approximately 33% breastfeeding at 3 months, and the WHO sample criteria is 100% ever breastfeed, 100% predominantly breastfeed, 100% still breastfeeding at 12 months. So we can conclude that WHO growth chart use a healthy sample in optimal condition compared with the CDC. There are two types of unit to assess nutritional status based on growth chart. This is the percentile and the Z-score. If we use percentile, the nutritional status data that we collect is in categorical data, while the value of Z-score we collect data in numeric. This is the standard growth chart WHO with length or height for age. For girl, birth to 5 years old, the pink color show growth chart for girl and the blue for boys. And this is chart using percentile. We can see that the lines show the categorical, for example, third percentile 50 percentile. How to plot height data in the chart? For example, the girls age 2 years 4 months, 3 years 3 months, and 4 years 2 months. We give mark the meeting point between age and height. So we can mark this in the meeting point on the X and H. Finally, we move on the interpretation. In Indonesia, based on growth chart standard WHO, stunting assessment based on Z-score value, length or height for age can be grouped into the following. Severely stunted under 3 years minus 3 standard deviation, stunted between minus 3 standard deviation and under minus 2 standard deviation, normal between minus 2 standard deviation and 3 standard deviation. Stunting occurs when a child fails to grow properly according to his age. A child is stunting when growth is slower than normal level, as determined by WHO Child Growth Standard. As a result, a stunting child is too short for his age. Right? We go to development and implementation anthropometric method in community setting. In Indonesia, child growth monitoring is done by Health and Nutrition Integrated Service Center, namely Posyandu. Posyandu program is supported by Indonesian government and held every month in every village level. The operation of Posyandu supported by cadre or village health volunteer. Since 1970, Posyandu use Kartu Menuju Sehat. Kartu Menuju Sehat is a note to record and monitoring the growth of under 5 children based on wake for age indicator. KMS for girl is different from boys. The latest KMS provide growth chart based on WHO Anthropometric Standard 2005. It can be seen from the color of KMS, where the KMS for boy is blue with the description for boys, and the KMS for girl is pink with the description for girl. Beside weight and age, weights for age growth chart in KMS also contains data about weighing time, exclusive breastfeeding, and the minimum standard of weight gain per month. To be able to measure children stunting status, length for age or height for age growth chart is needed. Child health stakeholders in Indonesia have realized that the accuracy of measuring nutritional status by posyandu cadre is not good and can have an impact on the effectiveness of early detection of stunting case in children under 5. Then, a screening tool was developed to detect stunting in community by cadre. That is by using grow mat. This mat is made by thick plastic and there are a picture of boys and girls where the children will be placed according to the gender. The mat can be placed on the table when the measurement will be taken. In this side, there are fixed boards where the children's head is placed. The position of the child is the same as when we are going to measure body length using length board. GROMAT. GROMAT is not for collecting stunting data but for early detection of stunting as well as preventive effort to maintain alertness to the stunting problem in children under 2 years old. Measurement of length are carried out at the posyandu when exactly 3, 6, 9, 12, 15 and 18 months. If mother and children do not come to the posyandu, a home visit will be made by the carer to conduct stunting screening at home. How to use grow mat? First, spread the mat on the flat floor or in the table, top of table. Check the age of the child. Measurement of length were carried out for every child when exactly 3, 6, 9, 12, 15, and 18 months. Lay the child in the appropriate late section gender, boys or girl. Make sure the child head is firmly attached to the fixed board. Make sure the child head is not wearing a hat or ribbon or hair tie, thus preventing precise measurement. Position the child body as straight as possible. Make sure the knees is not bent. The heel is flexed and two are facing up. Look where the heel is. If in the green part, if heel in the green part, it's mean growing well. If heel in the yellow part, it means the child is still growing but at risk of stunting. So carer must identification the nutritional problem. And the last one, if heel in red part, it means a child have a growth disorder in length. Identification nutritional problem and recommendation going to a health service. That's all I can share. Thank you for your attention. Hopefully it will be useful for all of you. See you again. Wassalamualaikum warahmatullahi wabarakatuh.